Hi guys, today we want to talk about erectile dysfunction and what is the general treatments that your family doctor or your urologist will offer you. By the end of this video, you're going to see the 4 methods that are most commonly offered, and at the end also I'm going to tell you my method, what I personally use to keep my cardiovascular system healthy, my blood pressure in check, and to avoid any ED symptoms. My name is Arnold Broad at Healthy at 60 Plus. If you have any questions about this video or any of the videos on my channel, give me a call or text me at 609-410-4790, or you can leave a comment with a question in the comment section below this video. And let's see what we have today. The men that call me may not be typical of all men with ED. I mean, the guys that call me have pretty much exhausted many of the conventional methods and found that they don't work, so now I get the calls. And their experience with their doctors may also not be typical of all men with ED. But their stories across the men that I talk to are pretty similar about what happens when they see their doctor or their urologist. And the men tell me that they are never given info on the causes of their ED. Now that has a number of different possible reasons. One main one is that for most guys, your doctor appointment is 15 minutes, and that's pretty much it. And it's really hard to get anything accomplished in 15 minutes. I mean, to really get full medical history or to understand really what all the ramifications of ED are. So here are some of the treatments that are generally offered. Now the advice that is given most often is to take an ED drug such as Viagra or Cialis or Levitra or those kind of medications. They, for many men, are really good symptom relief. They don't really get to the underlying cause of the problem, but they're symptom relief. They work in about 50% of the men that are prescribed, and then over time many of those men start losing the effect of the Viagra Cialis because the underlying condition has deteriorated and they either need to up their dosage dramatically or it just stops working altogether. And then some men stop taking it because of the side effects. But that's generally the first line of attack that your doctor or your urologist will tell you. The next line of attack, if the ED drugs don't work, is injections, penile injections, or penile suppositories. Both of these are designed to dilate the blood vessels in the penis so that you get great blood flow and get an erection. Generally they work really well, though many men aren't really thrilled about doing either of those procedures, and they don't get to the underlying cause, blood flow problems. They treat again the symptoms. The next choice is something called vacuum pumps. There's a good chance you've heard about them. What they do is they pull blood into the penis, and then you use a band to stop the blood from escaping. Certainly a method that works really well if men have had prostate cancer surgery and have had nerve damage in that area so that they can't have an erection naturally because of nerve damage. Vacuum pumps are a great alternative. And the last and most drastic choice is surgery. There are 2 kinds of surgery that are primarily used. One is penile implants, and there's some kind of a pumping device either put into the scrotum or someplace on the body so that you can pump up the penis with this device. And the other type of surgery is to clean out the small arteries in the penis so that you get good blood flow. Certainly a drastic choice, and any doctor will use this as absolutely the last resort. my personal choice is to deal with the underlying cause of the problem, which is poor blood flow, which is generally caused by damage to the lining of the blood vessels. It's a cardiovascular issue, and nitric oxide therapy works great for that cardiovascular issue. It's a natural method to heal the lining of the blood vessels so that you get good nitric oxide production, you get good blood flow, and therefore good erections. There's a really good video on nitric oxide therapy. The link is in two places. One is in the description below this video, and then the other is in the comment section below this video. If you have any questions about that nitric oxide therapy video, this video, or any of the videos on my channel, give me a call or text me at 609-410-4790. I want to thank you for stopping by today and watching this video. Have a great day, and here's to your good health.